this last portion of the hour of our evening is the panel discussion. As Kusum said before, my name is Suja Roberts. I am the 2012 India Association of Minnesota Secretary. And it's my honor and privilege to kick off this final portion, the panel discussion. So this year's panel discussion revolves around the healthcare and medical technology trends in both Minnesota and India. And as a biomedical engineer myself, I'm truly excited to hear our experts talk. You know, I've actually had the opportunity to talk to our panelists and moderator and get to know them over the last, month and a half. I've heard about their experiences and, the wonderful things they're doing, not only to better our community, but to better our world. And let me tell you, it's truly amazing. And I'm honored that these individuals have joined us tonight to talk a little bit about their experiences. But you know what? Someone's got to be responsible for all the brain power that's going to be on this stage. And that brave soul is Dr. Rajiv Aggarwal, our moderator for the evening. So Dr. Aggarwal is a neurologist at the Minneapolis Clinic of Neurology. He was born and raised in Punjab, India, and he completed his medical degree from India and moved to Minneapolis in '99. And now has become a partner at the largest neurological private practice. So, ladies and gentlemen, a good friend, the moderator for the evening, Dr. Rajiv Aggarwal.
If I can figure out mine, then I can handle the brain power. All right. Thank you, and welcome, ladies and gentlemen. I'm here to ask some questions and pick the brain of our panelists about healthcare-related industry in India and Minnesota. As Mrs. Tomar was talking about the rapid growth and the rapid growth that we need in our upcoming future in India, I think there is a lot of opportunity to partner with US companies and Indian companies and looking at the market in India in terms of the healthcare. And healthcare is the biggest part of the GDP in US, so I think India has a lot of opportunity in that sense. I'm going to have Mike Hess come on the stage. He's a Vice President and Innovation Excellence. He is a VP of Innovation Excellence at Medtronic. He has been at Medtronic for 20 years, beginning as a biomedical engineer in the pacemaker research department. He has also worked in product development and systems engineering, clinical trial management, program management, and product planning marketing. Mike is a Medtronic Technical Fellow, a member of the Beacon Society, and has about 25 issued patents and numerous publications. He has a BS in Biomedical Engineering from Case Western Reserve University and an MS in Software Engineering from the University of St. Thomas. As VP of Innovation Excellence, Mike leads the Medtronic R&D Council, which is primarily focused on R&D productivity. Mike also leads activities focused on improving the culture of innovation and collaboration at Medtronic, emerging markets R&D, and serves as the primary sponsor of internal technical employee organizations. And I invite Mike on the stage here. Mike. And I think you sit right there. I think you will be talking from there. That's the plan. Sunoj, is that the plan? Okay. And the next we have Barb Patterson. Barb Patterson founded Emerson Consultants in 2003. after a long career in marketing, reimbursement, and communications with a number of best-known companies in the medical device industry. Currently, she partners with numerous medical device, diagnostic, and biologic companies, from startups to multi-billion-dollar organizations, to help them achieve their business objectives through integrated reimbursement, regulatory, clinical, and market development strategies. Prior to starting Emerson Consultants, Barb served as Director of Marketing, Reimbursement, and Communications for Spine Tech, now Zimmer Spine, and Director of Reimbursement for several large US companies. Her reimbursement experience includes successfully lobbying in US Congress for new federal legislation to secure reimbursement of a new technology, working with professional societies to obtain CPT codes, and working with the Centers for Medicare and Medicaid Services to obtain ICD-9 codes and payment for new technologies. Barb has also successfully obtained pass-through payments for new technologies. Barb holds an MBA from the University of St. Thomas, St. Paul, Minnesota, and BS in Medical Technology from the University of Minnesota, Minneapolis. She serves on the board of directors for a startup company. And I welcome Barb on the stage. And the next panelist is Dr. Suja Roberts. She is born and raised in southern India. Dr. Roberts spent the first 10 years of her career as an obstetrician and gynecologist in India before continuing her practice in the US. According to her, she decided to go into medicine because she wanted to help serve the needy and poor in India. And she was drawn to women's health in particular after seeing that women's health needs are often ignored by society in general and women themselves due to other priorities in their lives and a lack of resources. This is what motivates her to provide the best care for women. She speaks many different languages, English, Spanish, Hindi, Tamil, Telugu, and Kannada, and has a special interest in infertility, Uro-gynecology, minimally invasive surgery, and obstetrics. When she's not working, she spends her time thinking about how to keep working. So, and her passion is taking care of her patients in all stages of their lives. And she feels blessed and privileged that she is able to be their advocate and their doctor. She is a compassionate, kind, approachable, and available physician. And I welcome Dr. Roberts on the stage. And the next panelist is Dr. Saurav Paul. He's a nice, handsome, young-looking man sitting right here in the front. He's Director of Innovation Fellows Program at Medical Devices Center, University of Minnesota, Minneapolis. The innovation program trains the next innovators and leaders in the medical device industry. It is an intensive one-year program in which the fellows learn how to create new and useful medical devices in a disciplined, efficient, and cost-effective manner. Dr. Paul is spearheading efforts of building bridges between academia and the medical device industry and creating intellectual partnerships across the globe. Before coming to UMN, Dr. Paul spent over 9 years at St. Jude Medical, where he was the top inventor at atrial fibrillation division, SCM's fastest growing division. He has over 140 patents issued/pending worldwide. He has a PhD in biomedical engineering and MS in civil engineering from UMN. His MS in mechanical engineering from Indian Institute of Sciences, Bangalore, and BS in mechanical engineering from National Institute of Technology, Jamshedpur. He received his JD from William Mitchell College of Law, St. Paul, with an emphasis in intellectual property law and medical device amendment. Dr. Paul won the Best Brief Midwest region in the prestigious Saul Lefkowitz Moot Court competition hosted by International Trademark Association. And I welcome Dr. Paul on the stage. And I think there is a presentation Mike is going to do, and he has it over there. You want to come over here? That may be better idea.
Thank you very much. I want to thank IAM for the invitation to this event. I also want to thank you for the best St. Patrick's Day dinner I've had in many, many years. I'm not a fan of corned beef and cabbage, so thank you for this, and maybe I can find other ethnic organizations to host events in subsequent years on this date in the future. So I think everyone knows about Medtronic. Medtronic obviously is a large company here in the Twin Cities, but just if you don't know some of the details, it is about a 40,000 employee organization around the world. Has a very broad portfolio of therapies. Lots of engineers and scientists filing lots of patents, with a presence in every market around the world globally, at least with sales and marketing. And we are working on adding more engineers as well in that field. It may be obvious to everyone here, but why would we be interested in India even more than we have in the past? We just heard about how the economy of India is going to be growing dramatically, and how the plans have been laid out for a very systematic development of the economy to meet the needs of the society there. We also see from this graph that the talent is increasingly staying, the spending of engineering dollars is being increasingly growing outside the United States. India's not on this graph, but India is following that trajectory of growing while the United States is basically flat. There are a lot of countries, including India, that have put together very attractive inducements or encouragements to bring the type of engineering work we're doing, R&D work, to places like India to help bring up the economy and bring up the local talent. And so we're seeing that make it an even more attractive place to do the kind of work that we do. And we're also seeing, most importantly, local needs. We're seeing local needs of clinicians and patients that have a different perspective on healthcare should be delivered, and they may not want or can use the products we develop here in the United States for doctors in the United States, whether it's because of the cost or because of the way the healthcare system is delivered. So we want to understand those needs very well so we can deliver the right kinds of solutions. I was given the goal of talking about the partnership models of Minnesota and India, and reminded about 6 times I had less than 3 minutes to do this, and so I'm going to be just very brief until we get to our panel. But I want to point out also that, as you see here, India is 4th from the left in providing a lot of encouraging tax credits for doing R&D. So the environment is very ripe. And if you look at the countries that are to the left of India, they're not growing very much. They're relatively small markets and they're quite mature. So India really is on the curve, on the head of the curve, in terms of making it easy to bring places like Medtronic and other high-tech companies to India to do more local work than we have in the past. And I'll finish with the view of how would this partnership model work. Well, if you look at what we have to offer and what we need, India has, as we know, large unmet patient populations, large unmet clinical needs. India has many scientists and engineers. India has some talented clinicians. India has some experience designing clinical trials for pharmaceuticals, primarily. What does Minnesota have? Minnesota has lots of domain knowledge on medical technology, in particular medical products. All the major companies have headquarters or operations here. We understand how complicated these devices are and how to build them. So we can add our knowledge to the engineering talent in India. We also have a lot of patents and a lot of technology we can bring to this equation. We have scientists and engineers, not nearly as many as India, but we have plenty. And we obviously have lots of design, clinical trial expertise as well. So between the Minnesota expertise and the India market needs and ambitions, I think we've got a great recipe here for continued partnership. Thank you.
Thank you, Mike. And I'll have Barb come on the mic and give us her small presentation. Thank you, Barb.
Hopefully you can all hear me. No? Better? Okay, great. Well, I want to thank IM for inviting me to come tonight, too. This is truly a pleasure, and to have all you guys still sitting here on a Saturday night. I know it's late in the day to be talking about medical devices, but I just got back from India actually a week ago, so I am full of excitement and optimism about the partnership of what Minnesota and the medical device community here can bring to India. So I'm going to talk to you about a second company that I started a little over a year ago, actually. It's called Global Medical Device Sales, Inc., and our focus is really helping small to mid-sized medical device companies bring their products to both India and China. Our core areas of focus are cardiology, orthopedics, diabetes, and women's health and surgical instruments. And interestingly enough, about 18 months ago, I had a large venture group from China approach our company. We do consulting to medical devices, and he said, you know, there's a huge need in China and an interest in high quality US-made medical devices. And I thought, really? And we started looking into that marketplace, and right now we have 3 or 4 products that we are currently selling into China, and started looking at the India market as well, and realized that's an even untapped marketplace for a lot of US companies. A lot of the companies we had talked to don't have any presence in India. And certainly in the last 10 days when I was over there, I saw the need for companies to come over there. So our whole value proposition, again, is bringing high-quality, US-made, innovative devices. It's been said a number of times tonight that Minnesota is really unique when it comes even in the world as a place where innovation started. Medtronic was one of the earlier companies, but every major player is here: 3M, Boston Scientific, St. Jude, many, many companies. And from those is actually spurred a lot of innovation and startup companies. And so that's where I think Minnesota and India have such a great opportunity to work together. I always I talk a lot around the country here and sometimes international, and I want to always tell people, you know, Minnesota is a land of 10,000 lakes and truly at least 500 device companies. And it's not just the big companies we know, Medtronic, but think about all the manufacturers that make all the pieces for that, all the software engineers that go into it. A lot of companies here, a lot of technologies. You know, again, in India, too, I think the need is they want high quality. We met with all the major hospitals when I was there, a lot of physicians, a lot of distributors, and the need is certainly there. And exciting as it is, we will be setting up a company or a division in India as well, probably in Delhi, but we haven't quite made that decision yet. I was lucky enough to attend, I was on a U.S. Department of Commerce trade mission in the last 10 days, where we went to 3 cities, Mumbai, Delhi, and Hyderabad. As I said, met with a lot of physicians, hospitals, and distributors. Really a takeaway from that was everyone said to us, we need more devices, we need different devices, we want minimally invasive devices, we want the latest devices. We do a lot of medical tourism. We saw some of the suites in the hospitals. So India is a place where, you know, good health care is being delivered, and they need more products from those of us in places like Minnesota. The other thing that was amazing to me, my family business is in the construction business. I've never seen so much building as I have in India. They are building everywhere. I was also very intrigued by the bamboo scaffolding that's used. But many, many hospitals in many regions, which one of the physicians, I think he was from Star Hospital, says to me, I don't know, they're building so many hospitals, where are we going to get the doctors? So you guys need to work on that, I guess. But again, tons of opportunities there. But at the end, I think the thing that they came to us was, we want high quality, good value, innovation, and service. The thing we heard time and again was service, and I think a lot of U.S. companies might, you know, contact a distributor but really don't go over there and spend any time, and certainly that's what we want to bring to the table is going over there, understanding what the needs are, training, etc. So I'm getting, I think, a little warning, but I look forward to the panel and hope you guys have a lot of great questions. Thank you.
Thank you, Barb. And for the audience, you have some cards, and if you can write any questions that pop up in your mind as you hear these presentations, that will be very helpful for our discussion of the panel. And next I will welcome Dr. Roberts to come to the podium and give us her presentation. Dr. Roberts.
Thank you, Dr. Aggarwal. Good evening, everybody. Can you hear me? Good evening. Do you hear me? How about that? Good evening, everybody. Is it better? I would like to thank the IAM for giving me this opportunity to be a part of this panel discussion. In fact, when I heard about the topic for the discussion and about my fellow panelists, I thought, I wondered how would I, being an OBGYN physician, would fit in a panel with biomedical engineers and medical device consultants. So anyway, I thought I'll make use of this opportunity to share my personal experiences and challenges that I encountered in the field of women's health care, having spent more than 20 years in this field, half of which was in rural India. India was where I was born and raised. Well, currently I'm practicing at Clinic Sophia, which is a fantastic clinic which is located in Edina, Minnesota, and soon to be opened in Maple Grove location as well. When you look at the status of women's health care, you see that we find that there are vast global differences. Here are some of the challenges that I encountered when I was practicing in India. Gender inequality and bias due to a strongly rooted culture of son preference in Indian families. Consequently, Indian women have low educational opportunities, poverty, economic independence. Access to healthcare is very poor or limited, especially in rural India. And remember, 70% of India is rural. High mortality and morbidity related to pregnancy and reproductive years and fertility. India is one of the few countries where men and women have the same life expectancy when they are born. But women lose this advantage because of high mortality during childhood and reproductive years. There is a high prevalence of violence against women, especially domestic violence. Cultural beliefs, myths about health, especially around pregnancy and prenatal care, are contributing towards increased mortality and morbidity in these unfortunate women. Lack or complete absence of preventive health care, including screenings, especially cancer screenings, have contributed to increased deaths. When we examine the challenges that we come across in rendering health care to women in the United States, we see that rising costs and healthcare reforms have limited annual exams and important screenings. Absent healthcare to a special group of women, especially by the virtue of barriers created by poverty, cultural differences, race or ethnicity, geography, sexual orientation, gender identity, have contributed to healthcare inequities. Prevalent domestic violence or intimate partner violence is also very prevalent in all classes and all age groups of women in this country. And special problems posed by epidemics of obesity, smoking, and other lifestyle factors. All in all, I would like to conclude my presentation by quoting this very profound remark and quote by Pandit Jawaharlal Nehru. And he said, "You can tell the condition of a nation by looking at the status of its women." Thank you for your kind attention.
Thank you, Dr. Roberts. And next on the list, we have Dr. Saurabh Paul, who's going to be giving us his presentation. Dr. Paul.
Can you hear me? Good evening and welcome everyone, and a warm namaste. I'm going to start off my presentation just borrowing some themes from Mr. Anish Chopra, the Chief Technology Officer of the United States, from a presentation that he made a couple of years ago in a forum like this. So now, since we are talking about partnerships and talking about progress, I want to see where our potential is for that progress. So now he borrowed some information that I updated since then. That information comes from ITIF, which is Information Technology and Innovation Foundation. They did a worldwide research to see where we stand. And where we stand is kind of a little blurry here, but as you can see, in the innovation standing across the world, the United States stands 4th right now. Where does India stand compared to that? 43rd. But then our CTO looked at the data in a little different way. Question was, what is the trend? Where are we heading? When you do that analysis, this is what we see. The United States stands 43rd. India stands 13th. So what can we do about that? Based on the assessment that was made early in the Obama administration, this is what became the priority of that administration. Number one was to create game-changing innovations. And within the game-changing innovations, of course, medical device and healthcare became one of the top priorities. So now, Minnesota has always been a leader in this kind of respects. So where do we stack up in this national game? Well, University of Minnesota has a very proud and very distinguished status in all of this. It's the number 6 standing in the world in technology transfer and commercialization, number 9th in public research universities. Within the United States, it's the number 6 in public research university. Number 7 for the total research dollars that have been spent. These are, of course, these numbers are a little outdated, but the trend still holds. And the scheme continues on other areas as well. And so is it for the Minnesota industry. Look at where we stand. Number 1 in the United States in medical devices. Number 1. Number 2 in business startups in life sciences. And the list continues. So we are very well positioned for a Minnesota-India partnership. For University of Minnesota, especially, 6 years ago, the state of Minnesota made an investment in the University of Minnesota Startup Innovation Program. I came on board 6 months ago to be a part of that program. And I'm leading this charge to develop medical device innovation. And these are my 8 jewels. I call them Super 8. And they're a mix of mid-career professionals, MDs, PhDs, MBAs from some of the top institutions in America and across the world. Some of them have left standing offers of $250,000 of salary to come here be a part of this program. They have started several companies to be a part of this program. The mission is very simple, to come up with path-breaking innovations that can change the world. Yes, these are big statements, but we are delivering upon it. Within 6 months, this group of 8 folks have already submitted 45 invention disclosures, all ready for absolutely knockout patent filings. And there are more. In the next couple of weeks, 20 more are coming. Still breaking all records. In the first year of the program, just as a comparison, we had only 15 invention disclosures. We are already breaking all norms. So now this program is essentially a program. It's a 1-year intensive program. And it comprises of steps like where you come up with the ideation and you come up with inventions. But then if you are to achieve this entire goal where we can deliver cheaper, faster, and better medical devices, you have to do something more beyond that. You have to incubate those ideas. You have to make them into tangible products. This is where industry comes into play. And we also need time. But we are not alone in this game. Countries like Japan and India are struggling with the very same notion. I just visited India at the invitation of the Indian government. And I'm happy to say that of all the institutions in the world to start this collaboration, they chose us. They chose us because of this Minnesota-India partnership that we are trying to bring forward. The objective is very simple, is to deliver affordable health care. That's the common need of this country, as of course is the need for India as well. And how do we get there? By building an infrastructure for medtech and having international partners. Thank you very much.